Good afternoon. Hello, Amy. Hello, India. Thank you so much for joining me this afternoon for this quick intern chat, question and answer session with University of Oregon Internship Director Amy Sybil and former Lane County Community Health Center's intern India Davis. Thank you so much for your time.
Hi, thank you so much. We're glad to be here, aren't we, India? So the way this works, so I'm the Director of Internships and Career Readiness for the Human Physiology Department at the University of Oregon, and we have some students who would love to hear some reflections from India's experience over the fall 2022 term as an intern with Lane County Community Health Centers. We're so grateful for your time and your perspective, India. I have just a few questions for you that we'll share with future students who may be applying for positions there. The first question that I want you to reflect on is what skill or couple of skills do you feel applied the most during your internship experience? And where did you learn those? Did those come from a classroom or outside of a classroom setting?
So the skills that I would say were most exercised were just building those relationships with patients and just exercising friendliness, filling out everybody's character so you know how to respond appropriately. Different people respond to different things differently, no matter, it's not what you say, it's how you say it at the end of the day. So really just working on those people skills and those social skills, throwing yourself into different environments because people who come to see you in the healthcare field are from all different walks of life, from all different professions. So it's really helpful and insightful if you can gain knowledge in areas outside of health because you'll be able to better relate to your clientele and take care of them better.
Excellent. Yeah, those people skills, those interpersonal communication skills, empathy. Wow. Yeah, those are touching on some really important skills, and they may be touched on in classrooms, but it's also something to hone outside of a classroom. Fantastic. Um, what new strengths do you feel like you developed during your internship with Lane County Community Health? And how do you feel like they are going to apply to your future career?
Mm-hmm. So personally, I think I gained better understanding. I worked with a few nurse practitioners, I worked with a few doctors as well, and I really appreciated how, even though I knew about some of the health conditions, they still went into depth, they still explained it. And from those, small conversations about each case, each patient, I was able to learn a little bit more. And I'm able to apply that in class actually. If they bring up like something like fibrosis or things of that sort, I'm able to now think back to my internship instead of thinking back to a textbook definition, which makes it a little bit more personal and easier to visualize. So I would say that's the best knowledge that I've picked up from this internship is just somebody who's a visual learner. It's made it super, super just meaningful and valuable to me.
Oh man, I love hearing that. Not only does classroom information get translated to your applied setting, but the things you're learning in your applied setting is coming back into the classroom when you're there. That's really, really cool, India. Okay, let's move on. Here's an interesting question. What was maybe an especially interesting or challenging part of your internship?
Mm-hmm. I would say the most challenging part is just kind of figuring out the boundaries. Can you be in that room with the patient? Can you speak to that patient? Just kind of you sort of have to go off of the environmental setting to understand if something is appropriate versus it's inappropriate. So always just keeping that in mind was a challenge because at the same time I'm very much a people person, so just to refrain sometimes was very hard, but it gives you good insight into just watching, listening, learning, and knowing how to take all that in and then reflect upon it later. So I think that was definitely the hardest challenge.
That's so interesting. Yeah, your kind of natural sense of empathy and compassion really comes out in that response for sure. Yeah. Um, the other part of my title, in addition to director of internships, is also career readiness. So I love to ask students, how did you feel about your professional readiness, right, when you started at the job? And has your perspective changed? Do you feel like your career readiness is now enhanced through this experience?
Mhm. So going into this internship, I wasn't super confident that I would get it just because I don't have the same background as some other students. I've always made it a point to get into different areas of practices just to make sure, okay, medicine's still the thing I want to do at the end of the day. So prior to this, I was with government job with the women's Lane County, not Lane County, I'm sorry, Santa Clara County Office of Women's Policy. So I was working with them for a little bit, and I was working with the Sheriff's Department. And at the end of the day, I still said, okay, medicine is what I want to do. So I just really appreciate Lane County Health Services for, really taking me in and allowing me to finally be in the field that I feel I'm most interested in, and the field where I feel I can help out most and impact lives the most. So I feel you're never going to be ready to step into a medical setting, which is the fun part of it, actually. But I like that you can't prepare for everything in the medical setting, which is something that's super valuable to me. So yeah, just no matter how much experience you have, it's always a learning process.
Man, that's some really great insight, that having these experiences built out your sense of confidence, not only in your skills and how you can apply them, but how well this field connects with you. And I think it's great that you also had that nice light bulb go off over your head that, oh, wow, like I'm going to encounter unknowns in my professional life, and that's okay. It's expected, especially in medicine. And that gives you the skills to navigate those unknowns and the confidence to do so. That's really cool. Okay, one last question for you. What piece of advice would you share with a UO Human Phys student or anyone coming on, hoping to have an internship with Lane County Community Health Center?
If anything, I would say that you just need to, again, have confidence in yourself. Having confidence can do a lot for you. It can change your mindset. It can change how you react to things. Just being proud of what you've done, even if the internship isn't for you, you should still be proud that you even took the courage to apply. So yeah, that would be my best piece of advice, is just have confidence in yourself, keep persisting. If it's something you really want, we need more doctors, we need more nurse practitioners, we need so many more health professionals, and people need to be represented. And somebody who's pursuing this path, they have potential to represent the underrepresented. So it's just something you really have to keep pushing for. And if everybody could do it, everybody would be a doctor. So yeah.
That's so inspiring. Yes, thank you. I love it that you are encouraging folks to persist, do hard things, and really believe in themselves. I can't think of any better advice. That's wonderful. Thank you, India, so much. And yeah, if anyone has questions, they can reach out to me on the UO Human Physiology website. Thanks so much.
Of course. Thank you.
Okay, Laura, I think we're done.
Well done, ladies.
Yeah, India, that was so great. Like you just already
You
had
did.
answers prepared. Those are going to really resonate with the students, I think.
I think so too.
Definitely. And look at that. We kept it to like 9 minutes, I think.
There you go.
Perfect.
Frankly,
You should
Lauren,
get
this
extra
is
credit. You should get extra credit.
right, like gold star for you. And
Give
you
me
know
your
what
brother's email. I'll send it to them.
perfect. You know what struck me between this one and the one where we interviewed practitioners is that this is probably easier for students to follow, a dialogue between one person asking questions and one person answering them. So I think this worked out actually exactly how it needed to. So that's great.
Perfect.
Yeah.
Thanks so much for your time. I really appreciate it.
Oh,
Thanks
no.
to both of you.
Thank you guys for having me.
Absolutely.
Take
Thanks,
care.
India.
And India, you have
Yep.
my email address now. So if you see jobs or other internships, hit me up. Let's talk,
Perfect.
okay?
Thank you, Laura. Thank
You
you
bet.
guys. Have a good one.
You too. Bye.